I'm Carrie Pauling with NorthcentralPa.com. I'm here with Dr. Rutul Dalal, Medical Director, Infectious Diseases, UPMC in the Susquehanna region. How are you?
I'm good. Thanks for having me.
Thank you for joining us.
Yeah.
So the numbers still show that we're a little bit in a spike.
Absolutely.
Can you paint a realistic picture of the current COVID-19 situation in the region and where you see us in the next few weeks?
The biggest thing which we see in the hospital is first we start seeing cases in the nursing homes and long-term care go up. Then we start seeing number of cases in the community go up, followed by increased amounts of deaths. But between the increased amount of numbers in the community and the deaths, the intermediate step is we start seeing a spike in the hospital numbers. So just speaking about UPMC Williamsport in particular, we were at a situation just 10 days ago when our cases were up in the above 80 region, like 84, 82 patients. It has slowly started to come down. We are in the 50s, sometimes in the low 50s as well, which has been a big change over the last 2 weeks. Not saying that we're still out of the woods yet. This is continuously evolving situation, especially because the new strains which are coming up, like which probably people might have read about the England strain, which is also right now here in Pennsylvania. Just last Thursday, we had our first case in Dauphin County in the Harrisburg area. As more and more people get inoculated with the vaccines, my hope is that eventually we'll be able to gain control of this virus, provided at least 65 to 70% of the population takes the vaccine. Now, we're talking over here globally on a countrywide scale, but even in a county or in our surrounding areas, even if 70% of people would take the vaccine, it would really stem the virus from percolating further deeper into our communities. Having said that, if everything of all ducks in a row, if people continue doing the basic 3 Ws like hand washing, watching the distance, as well as masking, as well as getting the vaccine, then hope is that by June, we should have a good control and handle over this virus.
The vaccine is here and it is being rolled out. UPMC Pittsburgh reported that they given more than 41,000 doses to the staff.
Right.
Locally, how are we doing?
Well, we don't have the numbers from today, but from yesterday, we had, that was January 11th, we had around 3,100 employees get the vaccine. And the second phase has also started. And our goal is by end of January, we want to finish all our healthcare workers who are on the front lines of this. And then along with it, the UPMC also has to comply with the 10% of vaccines going out to non-employee-based people as well, which are like, probably non-UPMC providers who come to work, and also our long-term care facility users. And we have been concentrating on that as well per the Department of Health directive. At least more than 80% agreed to take the vaccine. As you know, this vaccine is completely voluntary, and people have really showed a lot of enthusiasm. In fact, our numbers for the COVID vaccines are higher than even the flu vaccine. So there is a lot of enthusiasm. Some people are taking it just because it's the right thing to do. Some are taking it just to prove that, and set an example for the community that it's a safe thing to do.
Speaking of the vaccine, I'd like to just ask you a couple of questions that have come up with our readers. Let's say that I have grandparents who have both been vaccinated, but I have not been vaccinated. Am I safe to go visit my grandparents who have been vaccinated?
Well, I would say it's too early to do that. There is still a realistic chance that in spite of taking the two vaccine series, they can still have a theoretical chance of getting the virus from you, especially if we don't adhere to social distancing and masking. Until and unless we have at least 2/3 or even more, 70% of the population vaccinated, and if the community develops herd immunity, only then probably it would be safe to do so. As of now, you should still not do that, because even though there is only a 5 to 10% chance after taking the 2 vaccines, it also depends upon the type of strain you have had. So far, it's going to be covered with this vaccine, the England strain as well, but it also depends upon the viral load. What is the load of the virus being percolating, being given from one person to the other? So there are a lot of ifs and buts, and so there's always still a chance. So I wouldn't advise discounting the social guidelines.
People who have allergic reactions to other vaccines have been recommended to not get this vaccine. Are there other allergies that are a cause for concern, like nuts or environmental allergies? Would those types of allergies also put you in that category?
Not really. Now, technically, if you're allergic to any kind of vaccine, as you said correctly, you shouldn't take the vaccine. Now, if you have allergies to any other kind, which requires you to use an EpiPen or keep something like a rescue EpiPen on you, again, you shouldn't take the vaccine. If you have had allergic reactions to other stuff, but not like severe enough, causing anaphylaxis like tongue swelling or lip swelling or difficulty breathing, you can take the vaccine. Although, like, if you have any major allergies to anything else, you are supposed to be monitored for 30 minutes after the vaccine is given to you. Or if you don't have any allergies of any kind, 15 minutes is supposed to be monitored. Now, people will have side effects from the vaccine, such as muscle pain, fever, sometimes malaise, like muscle fatigue, but that should go away by day 3 of the vaccine. Now, this particular vaccine depends, like if you're using the Pfizer one or the Moderna vaccine, it depends upon the components. For example, talking about the Pfizer vaccine, they have sucrose, they have a protein stuff, they also have a lipid envelope around the virus. It's like a nanoparticle. So if anybody has had particular side effects to any of the components, most commonly is sometimes people say you have allergies to artificial sweeteners. Then they should talk to their healthcare provider before getting the vaccine, because then the components have to be checked. What's there in the vaccine, and it's readily available online. Also on cdc.gov, you can find out the components of each genetic vaccine, which is the Pfizer and the Moderna for now, and then compare and then decide.
Can a person who has been vaccinated still be a carrier of the virus, although they may be asymptomatic? Let's say a healthcare provider has been vaccinated but lives obviously with their family who has not. Is there still?
There's still definitely a chance, absolutely, for them to be a carrier, because you need that spike protein, which is the knob-like structure outside the envelope of the virus, to attach to a receptor. And even though it attaches to the receptor, you won't probably not get affected by the virus, but you can definitely shed that virus to others, especially who are immunocompromised. Of course, this is very much evolving, and so far they haven't found that in abundance, but it is definitely a possibility. And one should still take care and continue with the basic social etiquettes.
Are you concerned at all because people are relaxing, thinking that the vaccine is here now so we can take a deep breath and relax all of our practices?
Yeah, and there is definitely a false sense of security. But again, we have 330 million Americans to inoculate. That's a huge, huge number. And we have hardly finished the 1A group, which is the healthcare workers and the frontline workers who are working. So still a long way to go. And as I said, there are many people who are either completely against taking vaccines, or people are scared of taking the vaccine, or some people are still waiting for some other few more months to go by, and then they will take the vaccine. So until that group is all done, and as I said, until at least 2/3 of the population or even more is inoculated, we cannot really step off the gas pedal right now. We still have to continue full-fledged. In fact, we have come this long, it has been going on since March of 2020. I would say, this is not the time to, to lose steam. And I think we should go full throttle ahead, because still the next 4 or 5 months are very critical.
It does seem like there's still a lot of work to be done. Can you talk to people about how they can manage their pandemic fatigue and their anxiety?
Well, pandemic fatigue is definitely a big term which just came in. It was always there, but we never had such a global proportion of a pandemic in our lifetimes. Having said that, it's just considered to be, you should just consider it to be a way of life. You are supposed to wear a seatbelt while you drive. You are supposed to not drink and drive. So just consider this as a new lifestyle choice. Also, this is just going to be only for a few more months. If you have weathered the storm for the last 9 to 10 months, I would say another 5 or 6 months and we should score a home run. So I would say at this point in time, inculcating healthy habits, thinking deeply, talking to your kids, talking to your elders in the house, talking about the pros and cons of, of keeping yourself safe, And always asking the why behind, okay, why are we supposed to do this? If that message is percolated amongst your own family members, you should get a good, reliable answer. And I've always seen that when you answer the why, people are ready to accept stuff which is being told to them. I would suggest, like, stick to one source, and that source should be a public health agency. It also should be from a trusted public health entity as well, like the Infectious Disease Society of America, like the CDC. And years of experience has been put into people who work on these things. The advisors who give that information practice what they preach.
You're doing everything you can to keep you and your family safe as the COVID-19 outbreak continues to affect our daily lives. Wearing a mask, washing your hands, and physical distancing.
But there's one more thing you can do. That's staying engaged in your health care.
At UPMC, we are ready to treat you safely, either in person or through video visits.
Remember, we're here for you, now more than ever.